We are in London with Ella Vine, who is Executive Officer of Fibromyalgia Action UK, a charity which is dealing with this sickness, fibromyalgia, which is little known to the public. So first of all, I ask you, what is it and what are your actions to fight against and to help the research and the cure?
Hello, yes, fibromyalgia, it's a widespread chronic pain condition, and it is said that this is a central nervous system sensitization syndrome, which means that there is a pain amplification in the body, but it's not only about pain. It's also extreme tiredness, extreme fatigue that can be severely disabling, and there are lots of other symptoms involved with it. For example, insomnia, so sleep problems, brain fog, so problems with concentration and thinking, and memory loss, where people with the brain fog will forget words like I do sometimes. So if I do, forgive me. And also anxiety. Sometimes with fibromyalgia there can be depression, but it does not have to be, they can go in parallel. And also bowel problems, so for example symptoms like irritable bowel syndrome. And apart from the pain, there will be muscle stiffness and tenderness. So there's the whole spectrum of symptoms that make living with this condition really, really difficult.
What are the causes of this sickness?
We don't know yet. That is the problem, that currently the medicine does not know what is the exact cause of it. We cannot just pinpoint. What we know is that it's a disorder of the pain processing in the nervous system, but it's not only because of the wide spectrum of symptoms. There are other systems in the body that are involved, for example, like sleep. We know that two things that we know, because there is so far no tests can show that somebody has fibromyalgia, no medical test can show. So the diagnosis is all about excluding other conditions with the same or similar symptoms. But what we know so far is that people with fibromyalgia have less serotonin level. Serotonin, it's a hormone that is responsible for sleep, and also we know that people with fibromyalgia have more substance P in the spinal cord, in the fluid of the spinal cord, and substance P is responsible for pain processing. But that's all what we know, which does not really, no more research has been done how this tie up with the wider symptoms of fibromyalgia and the treatment. But what is important to understand, that fibromyalgia can be a condition that it really will change people's lives, and it will make it really hard. It can be severely disabling. Lots of people with fibromyalgia are bedbound or housebound or are in wheelchairs and are unable to work, but not all. Some people are able to work and some people are able to work full-time. So it really varies to a degree. It's very much individual condition, and the symptoms are really individual and not the same. Two people with fibromyalgia will not have exactly the same symptoms.
How many people are affected in the UK and also in other countries?
Well, we have some old research that shows that, you know, it was over 10 years ago, then in the UK up to 2.7 million people in the UK were diagnosed with fibromyalgia. But what we know that lots of people are not diagnosed. We are currently in talk with the Parliament and MPs and the government to do some more research on exactly how many people are diagnosed currently in the UK. But this is the research that is showing so far. It's a very, very common condition, and it sits within the musculoskeletal spectrum, although it is a neurological condition, kind of, because it involves the pain processing in the nervous system, but it sits because of the symptoms within the musculoskeletal, like all the arthritis and all the other musculoskeletal conditions. It sits within that.
So probably all over Europe we have tens of millions of people who are affected?
It's about 13 million people, I think, affected, diagnosed in Europe. The problem with this is that lots of people are not diagnosed, and on average the diagnosis takes in the UK between 7 and 8 years. Now that is really, really long time, and that is really bad, and we strive to work to improve that, so to make the diagnosis much quicker. Obviously some people, if they're lucky, because it's very much about postcode lottery, some people might be very lucky and seeing a GP or a specialist who have dealt with fibromyalgia, who is confident, who knows a lot about it, and will diagnose a person quicker. But we know lots of people who are suffering with this condition for 12, 20 years or more, and that's how long it took to diagnose them. And the issue with this is that if a person is not diagnosed, they don't know obviously what is going on with them, because it's so still little understood condition, and it's difficult to cope with them, to find the right treatment, but also to be understood by their family and colleagues, neighbors and friends.
What is the NHS doing, and what could it do more for these people?
The NHS is not doing a lot, and it could do a lot more. It's about postcode lottery really, because there is no, so far, no much interest from the Department of Health, and has never been. We are only trying to get them interested and involved now, but it's really slow and difficult process, and there has never been any funding from any of the UK governments put into fibromyalgia, not at all. So, but because of that, in terms of the NHS, it depends. It's a postcode lottery. It depends what area somebody lives. There are some hospitals, for example, that will provide fibromyalgia clinics, like the St Thomas's guys hospital in London. They've got award-winning fibromyalgia clinic, which is a multidisciplinary clinic and involves 3 specialists and help a person to manage the symptoms of fibromyalgia, because you can't completely cure yourself from fibromyalgia. And the specialist will be rheumatologist in that clinic. It's rheumatologist, it's physiotherapist, and also it's a psychologist to help with the psychological effects of fibromyalgia, because as with any chronic condition, with a condition where you live and every day you wake up and it's the same, you wake up exhausted, you wake up in pain, you just get up to brush your teeth and you go back to bed because you feel like you're just completely, sometimes you feel like you're dying because you're so exhausted, and it's like that every day and every day and every day. It can really it affects the whole person's lives, and it affects the mood. So this is one of the ways of dealing with fibromyalgia. I will talk about the different kind of treatment options that are there.
So, do people have a right to a pension when the condition is very severe?
Well, yes, fibromyalgia is recognized as a disability, so people can get disability benefits on fibromyalgia. So yes, absolutely.
And what about age? Is this condition making difference between old and young people?
In terms of the age, it is understood that mainly people, when they are diagnosed or when the symptoms start, is that between the age of 30 and 50. But the condition is affecting young people and people middle age and older people as well. So you can't really say that this is to do anything with the age, although some research shows that between the age of 30 and 50, and mainly women are affected, or that's where the symptoms start then. But what is important to understand that men and women are affected. There are more women diagnosed with the condition, which does not mean that there is more women actually having the condition, but that there are just more diagnosed. We don't know why. It might be because there are some biochemical things happening in the body we don't know yet about, what cause women to have more often fibromyalgia than men. But lots of men, thousands and thousands of men in the UK are diagnosed with fibromyalgia, so that is important to understand, because that is a kind of common misconception and still among some doctors, that it's only women suffering from it, and it's not true. So it's men and women, although more women are diagnosed, and also young people and children have fibromyalgia and are diagnosed with fibromyalgia, and it's very difficult to diagnose it, especially in children, because of the symptoms and the way the children would describe the symptoms. And in terms of diagnosis, again, there is a lot of persistence needed often on the patient side to keep going to the doctors, keep asking for tests, different tests to exclude other conditions, and not to kind of allowed for the doctor who does not know a lot about fibromyalgia to tell you that it's only in your head, because that's what people hear. Oh, it's only in your head. Oh, you're just tired, and it's not. So it's a lot of persistence on patient side. So if you can imagine, if we're talking about children, it will require a lot of knowledge from parents to understand the condition and to keep going back to the doctors and diagnose the child. We as a charity, we provide a special booklet and information about fibromyalgia for everyone, but also for young people and children, and information for parents, as well as information for schools, how to help a child who has fibromyalgia.
So finally, is there any treatment for fibromyalgia?
There is no treatment to cure it. At the moment, you can't cure the condition. There are lots of treatments, different, to ease the symptoms of fibromyalgia, and I will quickly say a little about every one of them. To start with, there is some medication for the pain, mainly for the pain. There are some strong and lighter painkillers, for example, codeine, so quite strong painkillers that people receive for fibromyalgia, but they not always help. This is the issue, that they just don't help, or they don't help enough, or people have to have higher doses. There is quite a misconception in terms of opioids, for example, morphine and other strong opioids, where the doctors still prescribe people with fibromyalgia morphine and other strong opioids, why generally there is no evidence that it helps. So, for example, the European League Against Rheumatism, which is the European main body that deals with musculoskeletal conditions like fibromyalgia, do not recommend strong opioids for fibromyalgia because it does not help, and it causes lots of side effects that are really difficult, kind of add up to the condition, but it's very individual. So because they are not the same people with fibromyalgia who have the same symptoms, the treatment is very individual and depends of the individual person. So it's about finding out what works best for the person and working with the doctor, but also working the patient to work on his or her own to find what works best. Apart from medication, there's lots of other treatments, for example, physiotherapy, massage or water massage, heat therapy to ease the pain. Different types of exercise will work differently in different people. Some people really struggle to cope with any sort of exercise. Some people find that walks, everyday walks, little walks will help. So this is different. So it's very, very much individual. And also other type of therapy, for example, will be CBT, which is cognitive behavioral therapy, and this is to help the person to deal with the effects fibromyalgia have on somebody's life, because it has really negative effects. And there is a common misconception that fibromyalgia is all in your head, and it goes because somebody has depression or is feeling low. It's not, but it's rather the other way around. The fibromyalgia may make somebody feel low because you wake up every morning and it's all the time the same, and you're not able to live your life to the full. But what we try to encourage patients and people to live the life to the full, to their own degree, as much as they can. So it's a lot about being positive. So, for example, with the cognitive behavioral therapy, I've been using it for some time and I absolutely love it, and it helped me. It did not have any effect or impact on my fatigue, for example, or the pain, but it helped me deal with the condition. Although I'm not yet diagnosed with the fibromyalgia yet, so this is taking some time. I've got the symptoms. So, there are lots of other ways that people find helpful to cope. For example, art therapy and like doing creative work, because of often people are not able to work, and so they will find that there are other ways to help them cope and lots of people doing different arts and crafts, and art therapy helps. I mean, this is something that I'm using, and it helps a lot to cope. So there's a wide spectrum of different treatments, and it's about finding out the right one and not giving up. If one thing doesn't work, try another and try another. I can say, but this is about myself now. As I say, I'm not diagnosed. I've got the symptoms. All the blood tests come fine. We don't know what it is still. I'm getting there. It takes me a year, even though I know a lot about fibromyalgia. So far I'm trying for a year, and I'm trying to get there. Maybe sometime next year we'll get what it is. But even though I'm not yet diagnosed, so far the NHS didn't help me, because obviously I'm not yet diagnosed and all that. I have helped myself a lot because I've been bedbound for like a half a year, last winter, half a year ago, and springtime. I was in completely really bad state with the pain, with the fatigue. I was not really and I was in this really bad state. And when I've realized that these symptoms are similar symptoms to fibromyalgia, what I did, the first thing that I did, even though I knew a lot, I've read a lot about it, lots of research that is online, but I went to the library and I've read every single book about fibromyalgia, and libraries are really good. Fibromyalgia, chronic fatigue syndrome, and all these different ways of managing it, like hypnotherapy, for example, which I use. And then I went to the doctors, keep going for tests, but what I did straight away, I've changed my diet. For some reason, my body couldn't take coffee anymore, so I ditched coffee completely, but I've changed diet, a very healthy diet, and since then I'm taking all the vitamins and minerals and some other diet supplements for energy, for example, like coenzyme Q10 and all the other supplements that are available there, just to help myself. And what I did also, I've got a massage chair at home, which is very lucky, which I could use. It was a hot massage chair for the back pain, which I had constantly, which is broken now. And this is an interesting issue. My massage chair is broken now. I've got another one. I can't use it at all. It's just, I've used it once and it caused horrendous pain for the 4 days. It was just disastrous. So because lots of people say fibromyalgia, they can't do massage, and I think it works differently on different people. Now I can't use, but when I could use it, it really helped the massage. I've got a big, like a weed bag that you put all over on your neck and upper back, on your shoulders. It's a bag full of weed. You heat it up in the microwave, and it's a constant painkiller. It's just fantastic. Well, basically, I've been living with chronic pain for 17 years since I had spinal injury, and often it is said that fibromyalgia might be caused by spinal injury. I don't know what it is in my case, but I've been living with it. I never have taken any paracetamol or any painkiller for it, but I was coping with it in my own way. So massage and the heat therapy, but also what I did, I kind of calmed down my life. I stopped doing, which was very hard, I stopped doing lots of things, and I focused on only getting better. So that was my aim number one. So it's called pacing, the technique called pacing, when people with fibromyalgia and other fatigue-based conditions will have to manage their energy. For example, if they will go to a local store for little shopping, and then they might be bedbound for another 2 days because of the way the body deals with energy and metabolism. It's just not properly in fibromyalgia. So I did lots of pacing, and I started doing relaxation techniques like meditation and visualization and art therapy. That really helped me. And also I started doing CBT, which is cognitive behavioral therapy, just to deal with the effects fibromyalgia, the symptoms had in my life. And so what I was doing all those things together. So from healthy diet, pacing, taking time off, art therapy, different types of arts helping me, and meditation, visualization, hypnotherapy. I say about hypnotherapy in a minute, but that separately really helped. Taking all vitamins, all minerals, and heat massage, heat therapy and massage. I was doing every single thing every single day. So it's like 20 different things I was doing for every single day. I really made that commitment, and after about 4 months I was feeling much better. much better. I could go out and about, and I was feeling, what was the huge difference, I was feeling emotionally much better, because there was a time when I was really at my lowest. I had a low mood as well, and I could not change it. And hypnotherapy had huge effect because I had insomnia as well. I couldn't go to sleep. I was waking up exhausted. And what I did, I have hypnotherapy apps on my phone, on a smartphone, and I started using it for insomnia, and basically worked from the first night. It was fantastic. I just could go to sleep, and I slept through the night. It was fantastic. And I use still hypnotherapy apps for different things, that for like stress, anxiety, positive thinking, and a lot, and I use it every day. But since I've managed my sleep, I would say probably my mood increased as well, and I had more energy. So kind of it was slowly. How I tackled the symptoms was symptom by symptom. You know, you can't beat the condition. There is no cure, but what I did, I was symptom by symptom. I did lots of research. I've read thousands of pages of books and lots of reading, and I was whether it was insomnia, whether it was low mood, whether it was the stiffness and brain fog. You know, I was trying to tackle every single one, and by doing all together, in my case, it worked. And after 6 months of doing all this, there was a time, I know it's not possible, there was a time I was on holidays and I was feeling so fine for like whole week. I was walking around all day, never felt tired, no pain, nothing, and I thought, wow, I must be completely cured. Obviously I wasn't, because the symptoms came back, you know, after a week or so. But it just shows how much progress you can make, you know. And I still have the symptoms. I get tired every day, and sometimes I have to go to bed 10 times a day when I work, and I struggle, and I have to go to bed, but I have to get up because I have to work, and I have to bed, and it's just enormous, and the pain is there. But there is something change in my mind that I feel positive, and when the symptoms struck, I just feel and think, I'm taking the time out, that's fine, I'm just having a rest now and taking the time out. So and for that reason, I think I'm coping better with it. I maybe don't notice the symptoms or the fatigue that much, or the pain that much, and I feel like maybe it lasts now shorter, and after a couple of hours I can be back to normal.